We are the Association for Child and Adolescent Mental Health, or ACAM for short, and this is ACAM Learn.
I'm Dr. Amina Al-Yassin, and in this video we're going to be talking about top tips for supporting children and adolescents with anxiety disorders. We're going to talk about tips for parents and carers, for teachers and educators, for social and youth workers, and for friends and peers. If you are a parent or a carer of a child with anxiety, there's a lot that you can do to help. One of the most useful things is to talk about this, to explain to your child or young person about anxiety, about the fact that it can be a normal human reaction, in fact, one that can be very, very helpful at times. However, when it gets out of hand and it starts to affect our normal day-to-day life, that's when we need to do something about it. So it's useful to talk to your child about anxiety, about how to recognize anxiety. What are the signs of anxiety that you feel in your bodies? For some people, their heart can flutter. For other people, it might be that they get a tummy ache or a headache. It may be useful for you to share your own experience with the child to help them to recognize the signs of anxiety in themselves. Encourage your child to try and manage their anxiety with simple relaxation or breathing techniques. Doing these together can be helpful too, because the more your child or young person sees you modeling this behavior, the more they're going to be able to do it themselves. And really encourage them to ask for help when they need it. There is no shame in being anxious. There is no shame in any mental health disorder. And the most important thing is that we're able to talk about it with someone and get the help that we need. Another useful thing, especially when dealing with children or young people who are anxious, is to try and have a regular routine. Young people can often find routines very reassuring, very secure, and so try to stick to regular daily routines where possible. And if there's going to be a big change in the routine, or if in fact there's going to be a big change in life coming up, such as moving house, a holiday, or a change in the family structure, then try to speak to your young person about it as early as possible to try and help them to prepare. If your child or young person is anxious as a result of a particular event, such as a death in the family or a separation, then you may find that there are lots of books or movies that deal with this issue. And sometimes reading these together or watching these together can be a really helpful way to open up the conversation and to start to talk about what is troubling your young person. A technique which I find particularly helpful with younger children is that of the worry box. Ask your child to draw or write their worries and to post them into a box. And once a week or at any interval that is suitable for you, you can sit down together and work your way through them. It's a really good opportunity also to try and encourage your young person to think about different ways that the problems could be solved. And the more we empower them to think of solutions themselves, the more helpful it'll be, because it will build up their sense of self-esteem and self-efficacy, that sense that I can do this, I have done this before, and I'll be able to do it again. One of the things I found most useful in understanding about anxiety is that anxiety can sometimes be a cycle. And so if there is something that makes a child or young person anxious, avoiding it will help them to calm down, but only for a very short period of time. Afterwards, that avoidance actually makes the fear increase. And so for example, let's say your young person is afraid of dogs, and every time you pass by a dog, they want to cross the road onto the other side. Crossing the road onto the other side may make them feel better for a few moments. However, it'll also reinforce that feeling or that thought that dogs are dangerous and that I must avoid them at all costs. And over time, that fear will actually increase. And so one of the useful things to do if a child or young person is feeling anxious is to gradually and in a very supported way expose them to the things that they are worried about, slowly, and in a really managed and safe and secure way, so that they can slowly build up that, that belief that the thing that they are fearing does not warrant the amount of anxiety or fear that they have ascribed to it. So, for example, if your child is really worried about going to a sleepover or a party, try and gently encourage them, see if there's anything you can do to make them go. And then afterwards, very much talk about how they were worried, but they managed to do it and it was okay, encouraging that sort of growth mindset mentality and encouraging that sense of self-efficacy in them, that they are able to do scary things and that they're able to tolerate them and maybe even enjoy them. All families go through stress, and all families and all children and all adults go through worries. But how do you know if this worry is becoming such that you need to seek help from a professional? If you feel that your child or young person is so worried that this is really getting in their way of their usual activities, if it means that they're not really able to attend or perform at school as well as they usually do, or if they're starting to isolate themselves, to withdraw, or to avoid things that they usually like doing, or if the worries are affecting their ability to eat or sleep in a healthy way, that is when you should seek more help. And often, the school is a good place to first go, or your GP. Both will be able to signpost you to any further support that you may need. Finally, and very importantly, supporting a child or a young person with anxiety can be really exhausting work. And it's also common for children with anxiety to have parents or carers who are anxious themselves too. So it's really, really important to look after your own health for yourself, but also so that you're able to look after those that you look after and love. So if you feel that you are suffering from anxiety, do not hesitate to reach out for help or support. Speak to your GP, your therapist, or your mental health professional for more advice, and they will always be happy to support you.